COPD, pulmonary diseases, which include emphysema, chronic bronchitis, etc., are diagnosed today and are in fact one of the leading causes of disability, particularly among veterans in the United States. You might be surprised to know that diagnosing COPD requires one to infer the race of the patient. Why would they need to eyeball the race of the patient? In 1869, Gould publishes a study that claims, using veterans from the Civil War, that African Americans have lower lung capacity than whites. And what this means is that if a white and an African American have the same diagnostic result from a spirometer, the African American is much less likely to be diagnosed as having COPD than a white person, based upon this 1869 study that blacks have lower lung capacity than whites. So this still affects the diagnosis of a medical condition for disability outside of the military today is still based upon that same body of research. My name is Trevon Logan. I'm a professor of economics at The Ohio State University and a research associate at the National Bureau of Economic Research. When it comes to racial segregation in the United States, there's typically a standard story. We have to begin where America begins, which is with enslavement. So after emancipation, when of course we have for the very first time the vast majority of the African American population has some freedom to choose the location of their residence, we begin this process of racial residential segregation. So segregation begins almost by design in the founding of the Republic because you have a large enslaved population whose living situation is controlled by others. But once we begin the process of freedom, we see that there is significant racial separation by races that intensifies over time. The traditional narrative, though, is one where African Americans left rural areas, which themselves were highly segregated, and moved to urban areas in the Great Migration. Northern cities we think of as Rust Belt cities today, say Cleveland, New York, Minneapolis, St. Paul, Chicago, and others. And those areas, therefore, subsequently experienced white flight, where white residents moved to suburban communities where they not only formed racially segregated communities where whites and blacks weren't living together, but where whites also created their own municipalities. And in those municipalities, they did not have to share public goods with African Americans in addition. So this would include schools, police forces, etc. And the segregation in the United States, racial residential segregation, reaches its peak in the 1970s. And it's declined since then, but it is still higher than the historical levels that we measure for urban areas, say circa 1880 or 1890. That's the traditional interpretation of segregation. But there are two issues that are sort of left outside of that, or at least implicitly assumed to be true in that. The first is that segregation in rural areas that African Americans were leaving is a given and is largely unchanging over time. And the second is that this level of segregation is measured for urban areas and may or may not apply to rural areas over time. So in my research, one of the things that I've investigated is a new measure of segregation, which incorporates rural communities. In particular, this measure looks at the race of your next door neighbor. So it is at the most micro level that you can measure racial residential segregation. And what we find in that measure, for the first time, we can look at racial residential segregation in the entire United States. And we can look at it over time, at least until the middle of the 20th century, with complete count census data. And we found, surprisingly, that rural areas were just as segregated as urban areas, and they also experienced increasing segregation over time. So it isn't the case that segregation in rural areas did not have any changing features to it, and that African Americans were living on a black side of town in a rural community and simply moved then to urban areas, which were themselves experiencing increasing segregation. Even the areas that African Americans were migrating from were themselves separating by race. And you can think about this in sort of the likelihood or the probability that a black person lives next door to a white person. this declines by more than 25% over time from 1880 to 1940. So the traditional way we think about segregation as being a rural, or something that doesn't change in rural areas and being largely an urban phenomena is actually only part of the story. Segregation is a nationwide trend that is not just due to white flight to suburban communities in urban areas. It's something that's happening even in rural areas in the United States, and that's also intensifying over time. So one question that people might have is, how does a residential segregation measure work, and what are the different ways we can measure segregation? Typically, we measure segregation for urban communities, and we do it by basically taking a city, say we take Chicago or New York, and we cut it into very small boxes, and these boxes can either be census blocks or census tracts. What we do with those blocks is we look at the racial proportion in those blocks, whether the block is, say, 80% African American or 15% white or 20% white. And we measure the racial composition of that block relative to the racial composition of the entire metro area. So a city is labeled as segregated if there is essentially a lot of concentration of African Americans in a small, relatively small number of blocks. Or if on average the racial composition of these blocks is very dissimilar to the overall racial composition, which then tells us that there's some concentration of people of a particular race in a certain segment of the city in these blocks. There are some problems with those measures. The first is that those measures intellectually are actually similar to income distribution measures. So sort of like a Gini coefficient where you're looking at how much of the wealth is held by how many people. So what these traditional segregation measures look at is basically how many of the census tracts hold all of the black people in a particular metro area. The first problem that we can have with that is conceptual. So I don't know what census tract I live in. I honestly don't. I just moved, but seriously, I don't. And even when I lived somewhere for 15 years, I still couldn't tell you what census tract I lived in. So the building block of the segregation measure is unknown to most people. But I do know who my neighbor is. I certainly know who my neighbor is. I know what music they might like. I might say hi to them, hi and bye. And that might be what we actually are thinking about in terms of segregation. It also links conceptually because when we ask people about neighborhood composition, we literally put before them a map of a neighborhood and we actually place their hypothetical household next to other households on a street. So when we're thinking about segregation, we've measured it in this aggregate way due to data limitations, but the complete count census allows us to look at it at a much more micro level, which is who we're actually living next door to. So this measure of segregation then doesn't require that you take an area and break it into blocks. And even people in rural areas have neighbors, even if they're miles away. That is the person who's living closest to you, the person who you might be likely to ask for an assistance in an emergency situation, the person you might borrow a cup of sugar from, or today you might steal their Wi-Fi access. You think about neighbors. These are people who you're very closely connected to and who you may have strong preferences about when you're choosing where to live. That racial composition might matter much more than, say, a census tract, which is a large collection of blocks, or it's a neighborhood, but it's a very administratively determined. One of the questions when you develop this segregation measure is, well, what is it good for? So I can tell you segregation increases over time in rural areas, but it may not matter for any actual outcome. So there still is this fact of increasing segregation in rural areas, or the fact that there's heterogeneity in segregation in rural areas. Some rural areas are, in fact, very segregated, and some rural areas are actually quite integrated. So one question is, does it matter for something? And one of the first questions that we posed to ourselves as researchers was, let's think about an outcome that occurs in rural areas predominantly, although it might occur in urban areas as well, that we might think will be related to, say, segregation as we've measured it, as opposed to traditional measures or proxies that people have used in previous research. So we began thinking about segregation and Southern lynching. Lynching, as recorded in the data, begins in 1882 and lasts until 1930 in the most widely used lynching data available. And our segregation measure begins in 1880. So we're measuring segregation before we can measure lynching. And what we found in that project is that segregation has a very strong and positive relationship to lynching. In the segregation measure, a one standard deviation increase in segregation leads to an additional lynching in a particular county. And this means that segregation in rural areas, which we, once again, had no measure for, didn't think really mattered for something, actually shows to have a very strong correlation with a very real material outcome that's related to racial conflict, which of course is something that we think segregation might capture, or variation in segregation might capture. So when we found that, we wanted to link it then to some existing theories because, of course, before we developed this measure, there wasn't a way of capturing racial segregation. Now, economists would view this relationship between segregation and lynching as not being non-existent. So lynching is about, if it's economic power, it's about the share of African Americans, say, in particular occupations, and racial composition might matter, but not racial sorting itself. If you're thinking in the sociological relationship, it would actually be negative because segregation, in fact, racial separation, could be a substitute for other forms of reinforcing, say, white supremacy or racial hierarchy. It's in political theory that we find that our empirical result actually matches with some theory of social science theory of the relationship between racial violence and segregation. And in the political theory, it is where there's a political threat for African Americans or where you're using lynching as a means of reinforcing this political structure. And that's what we find in the data with the relationship between racial segregation and racial violence. So thinking about this long reach of segregation, one of the big breakpoints clearly is emancipation. And Reconstruction continues to be, for me personally, one of the most fascinating time periods in American history. You have one of the largest emancipations of people immediately from enslavement to citizenship, some would call it quasi-citizenship, but enfranchisement, voting, and political participation nearly instantaneously. In the United States, it remains, I believe, in world history, one of the most dramatic political events, moving from enslavement to immediate full participation in a nation's political life. And this brings a large number of African American politicians to power, ranging from serving in the Senate to the House of Representatives in the United States Congress to serving as tax administrators at the most local level. What we know are that over 1,500 African Americans are holding office during the Reconstruction era, which is around the time of 1865 to around 1877. What we don't know is whether they had any effect. And this is where the historiography of Reconstruction and the, frankly, racist assumptions made by previous generations of historians really hurt our ability to inform knowledge about this time period. The consensus from, say, the Dunning School, which was very, very, very informative and influential among American historians, is that Reconstruction was a failure. We certainly know that from the end because the goals of Reconstruction were certainly not achieved. But in addition to believing that Reconstruction was a failure, the Dunning School contained this idea that black political leadership was particularly ineffective because black political leaders were inept, they were prone to corruption, and they were also easily misled or prone to participate in activities that were not scrupulous. And so they led to divestment of resources and wasteful policies that put the South backwards. And so there was a redemption movement where white supremacy was reestablished in the South, and this was actually good for the South. And I want to interrogate that with new data on, first of all, black political leaders themselves and their effect on tax policy. And what I found was that African American political leaders did have effects on public finance. Where they were holding office, there were increases in tax rates, about per person, about an hour's wage at the time. So there was an effect of black political leadership, and I have found in my work with some identification strategies a causal effect of black political leadership. But the next question is, well, what does that black political leadership do? It is not the case that black political leaders agree or agreed at that time. But what I found is that there was broad agreement on two aspects. One was land reform, where they wanted to use tax increases to, in fact, force white landholders to break up their land holdings. We know that the South was a very large agricultural economy, but what a lot of people don't know is that the South actually had more land in inventory, in other words, land that was not being used for production, than the North before the Civil War. And of course, those who are formerly enslaved know that this land is not being put into production, and they want to use tax policy to force it onto the market to enable African Americans to become landholders. And I do find small effects on land tenancy. It did not lead to, their tax policies did not lead to African Americans becoming landholders, and we know that from administrative landholding data that African Americans did not. But what it did lead to was changing the cost of land, led African Americans in those places where African American politicians were holding office to be much more likely to be tenants on the land as opposed to sharecroppers. So it did result in a material change to their socioeconomic status. The largest effects, though, of black politicians were on African American education. And public education, even though it was segregated, was a long-standing area of agreement among black politicians. They wanted to have access to public education. In fact, as Du Bois argued in Black Reconstruction nearly a century ago, it was African American politicians who created the public school system in the South. And I do find large effects of black political leadership on literacy among African Americans in the Reconstruction era. So another aspect of looking at the Reconstruction era goes back a little bit to the Civil War, which is there were a large number of African Americans who served in the Civil War. And the Civil War itself put these African Americans who were veterans in a new capacity to be the recipients of federal benefits. Amazingly, at the time, in a period of extreme racial strife. So we know lynchings are reaching their peak in 1890. We know African Americans are being disenfranchised politically in the United States, particularly in the South, both de facto and de jure disenfranchisement. The federal government is expanding access to pensions related to war-related disabilities for African American veterans. So the first wave of liberalization comes in 1890, which changes the pension for Civil War veterans from being war-related illness and disability to being any illness or disability conditional on being a veteran. What I find in that project is that racial discrimination by physicians actually is related to the pensions that African American veterans received, even though the pension system itself was a race-neutral system. And this worked, and we can study this because we can look at the differences racially for pensions before this liberalization of the system. Because there were very little racial differences before, when the pension had to be allocated based upon war-related disability or illness. When it moves to a period in which physicians have a great deal of control over determination of the disability and its severity, we see a lot of racial discrimination against African Americans, even in a race-neutral system. When we disentangled this in that particular project was looking at conditions that required the physician to simply believe the word of the patient, or the veteran in this case, or conditions that could be verified medically. So if you look at a condition, for example, like a gastrointestinal disease, you're telling your physician, I have diarrhea, I have intestinal issues. That's not something that a doctor, even to this day, will be able to verify. It's a very subjective condition. If you tell the doctor that I'm having, for example, cardiovascular illness, the doctor can listen to your heart and see if there's a problem. What we find is that there's a really large racial disparities in the areas, for example, such as gastrointestinal diseases, which require the physician to simply believe the word of their patient. And there's much less racial discrimination for those sort of medical conditions for which there have to be, or there is some way of medically sort of determining or diagnostic procedure that could actually verify the condition. COPD, pulmonary diseases, which include emphysema, chronic bronchitis, etc., are diagnosed today and are in fact one of the leading causes of disability, particularly among veterans in the United States. You might be surprised to know that diagnosing COPD requires one to infer the race of the patient. Diagnosing COPD requires the use of a spirometer. And on that machine, what a physician must do is eyeball the race of the patient. Why would they need to eyeball the race of the patient? In 1869, Gould publishes a study that claims, using veterans from the Civil War, that African Americans have lower lung capacity than whites. And what this means is that if a white and an African American have the same diagnostic result from a spirometer, the African American is much less likely to be diagnosed as having COPD than a white person, based upon this 1869 study that blacks have lower lung capacity than whites. So this still affects the diagnosis of a medical condition for disability outside of the military today is still based upon that same body of research. And the same applies, of course, when we're looking at education and health disparities and more generally. Many of these policies actually have at their root things that were initiated in the late 19th century that continue to have material effects on racial disparities today. But why might it matter for economists to solve their race problem? I think the best way of putting it is that as economists, we are developing, number one, as an academic enterprise, truth. Second, we need to be innovative to solve new problems that develop as the economy transforms. If we are not an inclusive and diverse profession, we will not reach our capacity. As economists, we believe in efficiency and being at the production possibility frontier. If we are not an inclusive and diverse profession, by definition, we cannot be at the production possibility frontier. We're leaving innovative ideas outside of the scope of economics, and we're not incorporating the best practices and the best minds and the best knowledge that we can. That would mean necessarily that we're not doing the best economics.